Hello, my name is Keany Ottenwalder, and today I'll be discussing the modified Thomas test for the rectus femoris and iliopsoas. The modified Thomas test for the rectus femoris is a flexibility test that is used to see if there is any tightness with an individual's rectus femoris. The modified Thomas test for the iliopsoas is a flexibility assessment that is used to evaluate the flexibility of the hip flexors, specifically the iliopsoas. There are only two scores you can receive for the test, which is either you pass or you fail. To conduct the modified Thomas test for the rectus femoris, you must lie the person on their back onto a table or bench. As the person lies down, ask them to bring one leg up to their chest and let the other leg fall off the table. But instead of it falling off fully extended, allow it to drop with a bending of the knee or a knee flexion. Then ask the client to hold this position for about 30 seconds so the person conducting can notice any tightnesses in the rectus femoris based on the positioning of the leg. To conduct the modified Thomas test for the iliopsoas, you must have the client lie down on their back on a table, bench, or flat surface. Then ask the individual to bring one knee toward their chest while the other leg should remain fully extended along the table or surface. Then ask the client to hold this position for about 30 seconds so the conductor of the study can observe any signs of tightness in the hip flexors. Some common errors that may occur during the modified Thomas test include the hanging leg not being flexed enough, inaccurate observations of the thigh, and inconsistencies when clients simultaneously hip extend and flex the knee at the same time. The results of the modified Thomas test for rectus femoris is either a pass or fail. You fail the test if you are unable to drop the flexed leg and it is not parallel to the table, or you are not able to bend it at a 90 degrees. If you are not able to bend it at 90 degrees, then you have tight rectus femoris. If you're not able to bring the leg to parallel, you have tight hip flexors. The results of the modified Thomas test for hip flexors is either pass or fail as well. You will fail the test if the extended knee bends or rotates outward or externally rotates while the other knee is flexed towards the chest. I had my client Alex perform the modified Thomas test for the rectus femoris by lying down on a bench and simultaneously flex the hip and the knee on one leg and let the other leg fall in a flexed position. He showed signs of tight rectus femoris and a tight hip flexors on the left leg due to him not being able to let the leg fully rest on the table or let the knee bend all the way. On the right side, he passed as he was able to let the thigh touch the bench and the knee was able to flex to 90 degrees. The next test we did was the modified Thomas test for the hip flexors. For this test, he laid on the floor and brought one leg up to his chest and left the other extended. He failed this test on both sides as both knees began to either bend or externally rotate when he pulled his leg up to his chest. This suggests tight hip flexors, specifically the iliopsoas. Thank you for listening. Have a good one.